How do bacteria cause UTIs in your bladder? Have you ever wondered how bacteria can lead to urinary tract infections in your bladder? Understanding this process can help you take better care of your bladder health. Urinary tract infections, often referred to as UTIs, occur when bacteria enter the urinary tract through the urethra and start to multiply in the bladder. The most common culprit is a type of bacteria called Escherichia coli, specifically a strain known as uropathogenic Escherichia coli. This strain has unique properties that allow it to thrive in the urinary tract. The journey of bacteria begins when they contaminate the area around the urethral opening. This can happen for various reasons, such as sexual activity, improper wiping after using the toilet, or even certain activities that promote bacterial transfer. Women are generally at a higher risk for UTIs because their urethra is shorter and located closer to the anus, making it easier for bacteria to reach the bladder. Once bacteria reach the urethra, they employ specialized structures, like pili and flagella, to attach themselves to the lining of the urethra and bladder. This attachment is crucial because it helps them resist being washed away by urine flow. After adhering, the bacteria invade the bladder lining, which triggers an inflammatory response known as cystitis. The cells in the bladder respond by producing antimicrobial substances and signaling molecules to combat the infection. However, if the bacteria manage to outsmart these defenses, they can multiply and lead to the symptoms of a UTI. The bladder has natural defenses against bacterial growth, such as an acidic environment, high levels of urea, and antimicrobial proteins. Additionally, the mucus lining serves as a barrier. However, these defenses can be weakened by factors like injury to the bladder lining, urinary retention, or disruptions in the normal balance of bacteria in the vagina, often caused by antibiotics. When these defenses are compromised, bacteria can establish an infection more easily. In summary, bacteria cause UTIs in the bladder by moving up from the urethra, sticking to and invading the bladder lining, overcoming the body's defenses, and multiplying within the bladder. This process leads to inflammation and infection, which can affect bladder health. Recurrent infections or chronic inflammation may even contribute to bladder tissue damage, raising concerns about bladder cancer risk and overall bladder function. To maintain good bladder health, it is essential to practice proper hygiene, urinate after sexual activity to help flush out bacteria, avoid irritants that can harm the bladder lining, and seek medical attention promptly if you experience UTI symptoms. Always remember, if you have questions or concerns about your bladder health, consulting a healthcare professional is the best course of action.